Go ahead and start. All right. Okay, so we're gonna do a wet to dry dressing. We're gonna measure the wound and we're gonna apply an abdominal pad. Okay, so first I would gather my supplies, check my orders. I have an order for a wet to dry dressing change for a patient, Mr. Johnson. Once I got my supplies together, I'll set it up. We already took the old dressing off and we took off all the old padding and all that. Now we have our wound that's opened and ready to be cleaned. So the first thing I'm gonna do is wash my hands and put on my pretend gloves. And what I'm gonna do first is get my normal saline ready. You can just leave it that, you don't have to wash me a little bit. So I'm gonna open it up, got my pretend gloves on, open it up, palm the label, go to my trash can, lift it, come back, it's ready to go. Take off my old gloves, wash my hands again. Now I'm gonna put on my sterile gloves. I'm gonna put on one. Okay, now I'm gonna go ahead and close this up. I'm gonna, with my non-sterile glove, I'm gonna hold the saline with my sterile glove. I'm gonna grab my irrigation tray and take it out. I don't know why it's jammed in there. Okay, there we go. Now I'm gonna, with the label palmed, I'm gonna pour my saline. This is the last time I'm pouring saline. Okay. Now that that's done, I'm gonna glove my other hand. Okay. Now we're gonna set this aside. Okay. Now, before I start, I want to measure my wound. In the facility, sometimes they have these little Q-tips that are packaged, and on the outside, there's little rulers on the side that does inches and centimeters. If I have one of those, I can use that, right? If I don't, I know that my pinky at the crease is about 1 inch, so I can use my pinky. Starting there, the crease is right there, so that's 1 inch. It's about 1 1/4 1.5 long or tall, and we have 1.5 inches wide, and I would document that. So next, we'll check with the patient, and we'll check his the MAR or whatever if he's allergic to iodine. We'll also ask if you're allergic to iodine because our cleaning agent is iodine. So as long as they're not allergic to iodine, we can go ahead and start. So before I start, obviously we are already medicated the wound, so it shouldn't hurt when we apply stuff. We also got to watch out for in case it doesn't work. So we'll let the patient know to let us know to tell us if there's any pain that he feels. Okay, Mr. Johnson, remember, if you have any pain, let me know. So first I'm going to clean out the wound. Real nice. Also got to check for tunneling, make sure there's no tunneling. All right, it's a pretty deep wound. Now that we have it cleaned, we're gonna wanna irrigate. So I'm gonna get my irrigation. I'm gonna go ahead and irrigate liberally. Get all up inside it. Make sure it's nice and clean. Okay, put that back. Now that that's nice and clean, we're gonna get our gauze, and I have already pre-wet it. Actually, before I start, it's already wet from the past one, but I'm gonna use that. I would draw up some more saline and wet it there, and then we can separate it and then start packing. Good, nice and up. Nice and clogged up. Next, when I get our abdominal pad, I'm gonna go ahead and place it there nicely. Get our tape. Now, when we tape our abdominal pad, we want to make sure that if there's a wound on the buttocks, we don't tape the buttocks shut. And we check for that. This is a leg, but just so we don't leave any stones unturned, we want to get a tape to cover the leg. Okay, that is nice and taped. We want to have one more tape with the date and time and my initials of when we put it. And usually, you know what, we're going to put that on the abdominal pad. Nice and soft right there. And then right there, I would say the time, the date, and my initials. Okay, and if need be, we could wrap the leg with our little gauze right here. I can't do it now because obviously it's not a leg. But we wrap it around, make sure it's not too tight but snug. And then we would tape it, and next we would gather our supplies, clean up a little bit. Now that we're done, I would check with my patient, see if he's hurting, ask how he's feeling. If everything checks out, we'll clean up. We'll clean him up too, and we will ask if he has any questions. We will have the call light near the patient, have the bed at the lowest position, and that ends my check off.